My presentation is done on bladder cancer. The pathophysiology of bladder cancer. We have urothelial cells that are found in the kidneys, ureters, and the bladder. These urothelial cancers can occur in all three, but more common in the bladder. We have bladder cells mutating, and when that mutation continues to grow and multiply, it tells the cells not to die. And as it continues to grow in number and size, they form a tumor. That tumor invades and destroys normal cells. Here we have some risk factors. Chemical exposure. We have chemicals, black tea components. We have cigarette smoke. We have herbicides. We have chemicals found in dye for cloth, paper, leather. And of course, we know that smoke is the #1 cause of bladder cancer. What happens is when people smoke, the kidney filters, and when it filters into the urine, and that urine sits in the bladder. And each time this occurs, the bladder is exposed for longer periods of time with these chemicals sitting in it, which in turn causes bladder cancer. We have some other risk factors: early menopause, arsenic in drinking water, not drinking enough fluids, side effects of chemotherapy. And we have repeated urinary tract infections. Then it's also linked to treatment for type 2 diabetes. Then it's also linked to parasites found in fresh water. Clinical manifestations. We have blood in the urine, frequent urination, unable to void, excessive voiding at night, lower back pain limited to one side, burning during urination, pain during urination, weight loss, swollen feet, and bone pain. And here we have some assessment findings. And I include some pictures to kind of give you a mental picture of how each would look. We have that cachexia appearance, which is that physical wasting away, and that loss of muscle. Hypothermia. Have that pallor, just that pale look. Enlarged para-aortic lymph nodes. Pelvic mass. We have swelling in the lower extremities and swelling in the scrotum here. There's some labs and diagnostic findings. We have the urinalysis, which is the examination of urine for blood and substances. We have a urine culture, which looks for infection by placing sample on a dish to allow present bacteria to grow. We have the urine marker test, which is used along with cytology. We have the biopsy, which takes a piece of abnormal tissue to be tested. MRI is a tool to look for signs that cancer has spread to the bones. Then we have a bone scan, which detects if cancer has spread to the bones and check for elevated calcium levels. Then we have some treatments. Some treatments include immunotherapy, which is the body's own immune system attacking the cancer cells. And it keeps the cancer cells from growing and coming back. In terms of beam radiation therapy, is target radiation therapy from the outside of the body. Fibroblast growth factor receptacles targets groups of protein and cancer cells that help them grow. And this is just a picture to kind of let you see the stages, references, and that's the end.